Hi guys, how are you doing?
Hey, we're doing okay.
Good. How's early labor treating you?
Well, I'm getting a little bit of those, I think you called them contractions. And I was just wondering, I heard about this pain medication called, I think my doctor came in earlier, called it Nitrous Oxide.
Mm-hmm.
And I was wondering if we could maybe get some of that in here. Because I'm definitely in a bit of pain right now.
Okay, all right. Well, nitrous is a mix of 50% nitrous oxide and 50% oxygen.
Okay.
And we would give it to you through this mask, which would be connected to the wall with nitrous and oxygen. And it's been used in Europe and Canada for many years. It's very safe. It's newer to being used here in the United States.
So it won't hurt our baby?
That's one of the wonderful things about nitrous oxide is that it is very safe for you. It's very safe for your baby.
Okay.
We don't see changes in the baby's heart tones. We don't see any problems for the baby when the baby is born. So that's a wonderful, safe part about it. The other thing is that it can be very empowering for you as a woman to be able to put on the mask when you feel like you need it and take it off when you feel like you're done with it.
So I get to manage exactly how I take it in then.
That's right. You'll breathe it in for about 30 seconds and then you'll take the mask off and it will affect you for a minute or two. And each time you feel like you need it, you put the mask on. Usually that's at the beginning or right before a contraction gets started.
Okay. And what should I expect my pain to be like?
It can alter your pain and make it more manageable.
Okay.
It's not going to take away the sensation of labor completely,
Okay.
but it makes it more manageable.
Okay. And then how long will it take to have it start working then?
It works within about 30 seconds of starting to breathe it in, and once you take the mask away, it clears from your body within 90 to 120 seconds, so about 2 minutes.
And
What are the side effects for her?
Some of the side effects can be some nausea. Sometimes people will vomit. They can get dizzy. So we ask that you not walk around once you're using the nitrous for pain management.
Okay.
Some people can get what's called dysphoria, which is kind of a otherworldly feeling.
Okay.
But again, that goes away as soon as you stop breathing it in or pretty quickly.
Okay. So I can't be like walking around, but can I change positions or anything like
You
that?
can
to help?
definitely change positions.
Okay.
You can be on the bed on hands and knees. You can squat on the bed. You can lean up against your partner on the bed.
Okay.
All of
Just
those
no
are fine.
standing then.
No standing, no walking around. And we'll want to support you to the bathroom if you need to go.
Okay. And then
Call your
then
nurse.
when I stop taking it, because I can choose when I stop taking it. What will I feel like? Because I've seen some pretty nasty stuff happen from people who are on these nasty drugs that take away the pain. So what should I expect there?
Well, it doesn't affect your labor negatively, so it's not going to slow your labor down. It's just going to labor's going to keep going, and as long as you're using it on and off, it will help you to manage your pain.
Okay.
Let me ask you a couple of health questions just to make sure. I think in your chart, I saw that you don't have any history of opioid addiction or other narcotic use.
Not at all.
Okay, good. And it looks like you were adequate in your B12 and your folate levels throughout your pregnancy, very healthy. You don't have any breathing problems like asthma or other respiratory disorders.
Nope.
And you don't have any cardiovascular or heart disorders.
Yep.
Wonderful. And you haven't had a recent eye or ear surgery. Wonderful. Those are all the things that we might consider not doing nitrous oxide for you if you had. But since you do, what I'd like to do is show you what you'll do before you actually do it.
Okay.
You can take this into your hand and hold it up to your nose and mouth.
Okay.
And you'll breathe in for about 30 seconds just before the contraction or just as the contraction's beginning.
Okay.
And then when you're done with that 30 seconds, you'll take it away from your mouth.
Okay.
And you're the only one that can hold the mask, so we ask that you not hold it for her or I hold it for you. You're going to be the one who's in charge of doing that for yourself. So nobody's going to hold it on you and nobody's going to take it away from you. We'll watch you closely to make sure that you're breathing appropriately and that your heart rate stays the same. And
But
when
you
you
said
don't,
I should be fine though.
you
Like that-
should be
okay.
fine. Yeah, it's a very safe, very easily used pain management
Okay,
for
so,
labor.
so that sort of stuff, that's more rare stuff that I probably shouldn't have to worry about then.
That's accurate. You guys feel comfortable about this? We
Yes.
can get it
Mhm.
set up. I'll talk to the doctor about it.
Okay.
Okay.
Thank you so much.
Take good care, you guys. I'll see you in a few minutes.